impingement is that it's actually a compression, a physical, something physically is hitting, constantly bruising that tendon or the muscle itself, okay? So that's impingement, meaning the supraspinatus is not torn, at least not yet. There's no tearing of it, okay? Because a tear in the supraspinatus will give you the same symptoms, shoulder pain, all right? But you have to make sure in a tear, these tests will not come back positive, okay? In impingement, they come back positive, okay? So tears for the rotator cuff can happen in one of two ways. Two main ways to divide tears. If I ask you for a rotator cuff tear, the first thing you have to wonder is, number one, is it a partial tear? So only a little piece of it is torn, the whole muscle is not torn. Or is it completely, fully torn? In other words, the muscle has completely separated from the bone. Okay, so that's the two main things you have to think about when somebody says a muscle tear. Okay? The most common rotator cuff tear, again, supraspinatus. Right? Still the same one muscle. Okay? Alright, so yeah, partial thickness tear involves a superficial surface tear, or a full thickness extend through the whole surface of the muscle. It's gone, so it separates. Instead of it being attached, now it just has separated from the actual shoulder. For the back door, I think I do this.
Okay, so you have to let me know when you're leaving.
Okay, even if I lock it, you can get out.
Okay, so you lock it.
I'll lock it. That's fine. Alright, so here are all rotator cuff muscles. Okay, all rotator cuff muscles inserting into the head of the humerus. Remember that these three, infraspinatus, supraspinatus, these three, teres minus, infraspinatus, supraspinatus, all insert into the greater tubercle of the humerus. And the subscapularis inserts into the lesser tubercle of the humerus. Okay? Moving on. So, what tends to happen? When do we see partial tears and when do we see full-blown tears? Well, overhead athletes typically have a partial articular side tear. Okay, so old pitchers, all right, and this is more common in pitchers than anything else, because even in swimmers, that movement of the over the head arm is not as strong as a pitcher of baseball. Okay, these are the most common athletes to have partial articular tears. Okay, they occur in younger athletes. Okay, younger people, usually younger than 40. Okay, and they can actually tell you, look, commonly recall a single traumatic event that presents itself with shoulder pain. So they'll actually be able to tell you, I can tell you when it happened. It happened in this game, this inning, and exactly when I pitched, I felt it in my shoulder, the sharp pain that I gave. Okay? Symptoms, obviously shoulder pain, weakness, and a positive shrug sign. What is a positive shrug sign? Well, it says shrugging the shoulder with an attempted abduction of the arm. What does that mean? Well, here's what it's saying. Abduction of the arm, right, is this motion, right? This is abduction of the arms, right? So what happens is, when you tell the patient, I need you to do this movement, remember, the first 30 degrees are done by what muscle? Supraspinatus, that's the same muscle that got hurt. So what happens is, the muscle's still there, it still works, it's only partially torn. So when they go through this part of the movement, right, it hurts a lot. So what they do is they put all their weight into it. They try to use more of their deltoid, so they activate it. This movement like this is more deltoid than supraspinatus. So they shrug their shoulder to try to abduct their arm. Okay, so that is the positive shrug sign. Older patients tend to have a full tear. Okay? Older patients will have a full tear. That means that the supraspinatus has separated from the bone, right, Kayla? Yeah, did you enjoy your dinner? I hope you did. Okay. So that means Can they do these first 30 degrees?
No.
No, the muscle, the supraspinatus is gone. Right? So these first 30 degrees are no longer there. What do?
They push.
Yeah, they push with their arm, right? They push, they take a swing, right? Just to try to get their arm up there. Yeah, they swing their arm out, right? They use their whole force to try to move their arm up, right? Because slowly they wouldn't be able to do this. Right? They have to. And now the deltoid takes over and they can continue. They can do all this motion around here. But when it gets to this motion, that's all supraspinatus, right? Okay. So the symptoms depend.